Dear colleagues, this presentation was prepared by Professor Nazarov and me, Dr. Sibee Soundararajan, representing the International Association of Therapists Using Medical Gases. IAMGT was founded in 2019 by transforming the Asian European Ozone Therapeutics Union. IAMGT is a meeting place for doctors and scientists involved in the research and application of medical gases. At the request of Professor Nazarov, I will read this presentation and try to convey the ideas and approaches used by the members of our association when working with the medical gases. The topic of my report is the place of hydrogen in the family of medical gases. In this report, it will be argued that why ozone therapy, xenon therapy, hydrogen therapy, and carbon monoxide therapy are just an option of a new therapy called medical gases therapy. Using the example of ozone, xenon, and carbon monoxide, it is shown that the therapeutic properties are a mirror image of the toxic properties. It has also been shown that the therapeutic properties of hydrogen are a mirror image of the toxic properties of carbon monoxide. Probably it may reflect the carbon monoxide toxic effects of hydrogen on mitochondria. Based on the analysis of the mechanism of formation of hormetic effect of medical gases, a new approach to understanding the therapy with medical gases as a method of activation therapy based will be proposed. An express method that is based on the individual approach to the patient for monitoring the state of the body's adaptive system will be proposed. Medical gases, with the exception of oxygen, include hydrogen, carbon dioxide, xenon, carbon monoxide, hydrogen sulfide, nitrous oxide, and ozone. In this report, we will focus on the most well-known medical gases: hydrogen, carbon monoxide, xenon, and ozone. The slide schematically shows that the organs and the systems of the body on which the therapeutic effect of these gases is noted. In this diagram, the green circle indicates the therapeutic activity of hydrogen described in the scientific literature for the corresponding organ. Similarly, the blue circle indicates the therapeutic activity of ozone, the black for the xenon, and the red for carbon monoxide. The table contains the data of the spectrum of pharmacological activity of medical gases. Pharmacology teaches us the pharmacological and the chemical activities of a drug are related. For medical gases, this dependency is absent. Since hydrogen and carbon monoxide are reducing agents, ozone is the strongest oxidizing agent, and xenon has no chemical activity at all. This contradiction is eliminated by the statement that all gases, regardless of their chemical properties, are antioxidants. This far from obvious statement arose step by step. By this time, this issue was brought up to date. Ozone had been used in therapy for about 50 years. There was also theoretical ideas about the mechanism of ozone action. The basis of these ideas is the position on the determining the role of oxidative stress in the pathogenesis of any disease. Thus, a hypothesis arose about the so-called soft oxidative stress caused by ozone. In response to this, the body's antioxidant system is activated, which provides therapeutic properties of ozone. Thus, the strongest oxidizer, ozone, became an antioxidant. At the end of the 20th century, the data on the therapeutic activity of xenon appeared. The study on the mechanism of xenon was carried out using the same experimental techniques as research in the field of ozone therapy. It is not surprising that the results of these studies was discovery of the antioxidant properties of xenon, which are a consequence of the blockade of NMDA receptors. Carbon monoxide suffered the same fate, with the difference in the ferrous ions. The bilirubin and the biliverdin were recognized as the mediators of the antioxidant activity. And of course, the discovery of the biological role of hydrogen gas as a scavenger of the hydroxyl anion radical and peroxynitrate radical by Oshawa et al. In 2007 reinforced the opinion about the medical gases as antioxidants. These conclusions were recorded in the work of Nakava et al. In 2009. As an example, I present the general diagram explaining the biochemical mechanisms of the antioxidant and the organoprotective effects of the medical gases, built on the basis of search for their antioxidant effects. All this looks beautiful and logical. All that remains is to develop the practical recommendation for doctors using the medical gases in practice. However, here we are faced with significant difficulties. Since the concepts are familiar to the doctors about the dependence of the effectiveness of the treatment on the dose are completely inapplicable when medical gases. For example, for ozone therapy, the effective doses of ozone for treating the same disease can differ hundreds of times. The dynamics of the well-being of the patient receiving the therapy are also unpredictable. In practice, a doctor using medical gases works blindly and is guided more empirical observations than by theoretical ideas about the antioxidant activities. In trying to find out a way out of this situation, we drew the attention to one really existing circumstances, which is usually obscured and hushed up, that all medical gases are poison. This can be seen from the table taken from the article by Neko et al. This article was published in 2009. Accordingly, the toxicity of hydrogen was still unknown. In 2023, in the works of Zoki Zin et al., was demonstrated that the oxidizing the ferrous phosphorine in both free and protein confining states can self-catalyze the hydrogenation or reduction by reducing the with the hydrogen to catalytically scavenge OH, and can also catalytically hydrogenate to reduce the carbon dioxide into carbon monoxide in vitro stimulation. Thus, the reduction of the carbon dioxide to carbon monoxide, followed by covalent binding of a carbon monoxide molecule to heme ion, can lead to heme inactivation according to the well-known mechanism of conversion of hemoglobin into non-functional carboxyhemoglobin in carbon monoxide poisoning. This possibility was proven in the experiments studying the respiration of isolated mitochondria with high concentration of hydrogen by Nazarov and co-authors. According to the authors of the cited work, in addition to the known effect of neutralization of hydroxyl radical and peroxynitrate, a protective reaction develops in the cell, which can be represented as follows. The most pronounced effects of hydrogen and observed in humans, animals, and the cell are as follows. Blocking of the pro-inflammatory signaling cascades, activation of the NRF2 and the heme oxygenase, short-term decrease in the mitochondrial membrane potential, mitochondrial response to unfolded proteins and mitophagy, renewal of the mitochondrial population. It should be noted that the described mechanism of toxic action are observed at high concentrations of hydrogen and hypoxic conditions characterized by oxygen deficiency and increased levels of carbon monoxide. These circumstances should certainly be taken into account during the hydrogen therapy. We can state that all medical gases, without exceptions, are toxicants, and we will try to build a phenomenological approach to the problem of the mechanism of their physiological activity, and also try to develop the rules of their joint use and planning the correct course of therapy. Let's start with the fact that the history of medicine from the ancient times of the 17th century was built on the use of plants and mineral poison. The founder of the European pharmacology, Paracelsus, wrote a wonderful aphorism. All substances are poison, and there is nothing that is not poisonous, and only the dose allows you to hide the fact. The common simplification of the aphorism in the form everything is poison and everything is medicine. Both are determined by the dose, distorts its meaning. Since in the original belief, there are three word gift, which means poison in German, and not one word medicine. The only dose allows you to hide the fact. The part of the aphorism seems extremely important because it encodes what is now known as hormesis phenomenon. We further argue that the hormesis phenomenon is the key to understanding the mechanism of action of medical gases. Hormesis is when the small dose of some drugs are more effective than the large doses. Hormetic substances have a characteristic dose-responsive curve. The phenomenon of hormesis is widespread. For example, the slide shows the dome-shaped dose-responsive forms typical of hormetics for morphine, arsenic, cytostatics, and even for alcohol and its effects on the human social activity. Even in the plant world, one can find the phenomenon of hormesis. The figure shows that low doses of herbicides stimulate the plant growth. The phenomenon of hormesis has become fashionable recently to explain the mechanism of action of ozone and hydrogen because its essence seems mysterious. Meanwhile, the phenomenon of hormesis immediately becomes clear if we take into account two facts. All hormetic substances are poisons. A living organism is capable of defending itself against poisons. The dome-shaped dose-responsive curve is simply the algebraic sum of toxic and protective effects. Compare with the typical S-curve characteristics of traditional medicine. The above explanation of the hormetic curve implicitly contains the most important information about the type of protective reaction of the body to the action of the poison. It should be consist of denying the toxic effect of the poison. Below, we will confirm that the usage of example of ozone and xenon, which like other poisons have the doom sub dose effect curve. If a poison, for example, ozone clots the blood, then the protective reaction will consist of developing an anticoagulant state of the blood system. This is the reason for the fantastic success of using ozonated saline solution to treat the consequences of SARS-CoV-2 infection. Not a single patient in the red zone who received the ozonated infusions in different countries died. The slide shows that the therapeutic effects of ozone are simply a mirror effects of toxic effects. If a poison such as xenon is a nerve poison in large doses, depresses the nerve's activity and can cause complete muscle relaxation, then the protective reaction will consist of activation of the nervous system, which looks like euphoria and the antidepressant effects. The toxic effects of carbon monoxide, which consist in the blocking the transfer of oxygen in the blood and development of hypoxia, vasoconstrictor, and pro-inflammatory effects, causes a protective, anti-inflammatory, and vasodilator reaction, and also reduces the tissue hypoxia. Hydrogen has the same spectrum and the therapeutic action. The toxic effect of the which is the blockade of the heme in the respiratory chain of the mitochondria by carbon monoxide, which is reduced form of carbon dioxide. Due to lack of time, I cannot dwell on this, but I will be happy to answer the questions about the toxicity of hydrogen on the sidelines. We have just understood the essence of the famous aphorism of the founder of homeopathy, Hahnemann, similia sibilis curantur, or like cures like. The semi-mystical expression simply means that the integral protective effect of that the body develops is similar in form but mirrored in the essence of in relation to the toxic effect. Thus, if you want to use the medical gases or to treat a specific disease, you must use the subtoxic doses of the gas that produces the toxic effect similar to the symptoms of the disease. It is obvious that the therapeutic effect of hormetic drugs belong to the integral reaction of the body. Hormetics in general and medicinal gases in particular are legitimate tools of the integrated medicine. To complete the phenomenological approach to the medical gas therapy, we must determine that the nature of the protective effect of toxicants. According to one of the definitions, the poisons are substances that act damaging at the particular sites in cells and organs that are critical for maintenance of homeostasis. It is obvious that there are defensive reactions to the disturbance of homeostasis must be homeostatic. There is a whole class of unconditioned reflexes of the body called homeostatic. The homeostatic unconditioned reflex is just as real as the orthostatic knee orienting and the others. Innate homeostatic reflex were discovered about 100 years ago by direct students of the author of the theory of conditioned reflex. Ivan Petrovich Pavlov. Let's give one example. The experiment, the animal was repeatedly injected with an intravenous glucose solution and was observed with the kinetics of the glucose in blood. Then the animal was injected with the normal saline solution. What do you think the reaction will be? The response will be paradoxically hypoglycemic. This is easy to understand because each time the glucose is administered, insulin will be released as an innate defense reaction. With several repetitions, the innate reaction becomes a conditioned reflex. Let's illustrate the formation of this reflex using trait scales. Let's say that the arrows corresponds to the normal blood glucose level. Glucose infusion increases its level in blood. As a reaction of glucose increase, the insulin levels in the organism rises and the glucose concentration is lowering. Limitations of the glucose infusion as a physiological solution to animals leads to conditioned reflex of insulin formation and decrease the glucose level in blood. On slide, we see experimental works that covers all kinds of reactions of the body from neuropsychic to immune. It is considered a firmly established fact that the conditioned reflex protective reaction can be developed for any violation of homeostasis. Since the conditioned reflex reactions are developed only on the basis of innate reactions, this means that the body has an innate system of unconditioned homeostatic reactions to any harmful effect. In general, we can say that the conscious activation of the unconditioned reflex for the purpose of the treatment is the essence of integrated medicine, aphoristically formulated in the expression of Hippocrates, medicus curant natura sanat. The described picture of the therapeutic effect of medical gases would be incomplete without indicating the well-known integral system of the body, which is responsible for organizing such a complex reaction of the body as the homeostatic reflex. Could the antioxidant system play this role? Of course not. Given their diversity and specificity, of course, the antioxidant system takes part in the body's reactions to the medical gases, but the central role in this reaction belongs to the neuroendocrine system, which is the main system for maintaining homeostasis. Take, for example, ozone, which is an acutely toxic agent when inhaled. The favorite method of pharmacologists when studying the mechanism of action of new drugs is the inhibitory analysis. It consists in the fact that to establish the nature physiological reaction, the standard inhibitors of the known enzyme and the receptors are used. Such experiments were carried out during the ozone toxicity. Obviously, the proponents of the antioxidant consensus believe that the inhibitory assay should identify some antioxidant. Not at all. It turned out to be the adrenergic blocker metropron, which dose-dependently suppresses both ozone-induced increase in cortisone and the mortality of rats from ozone. Moreover, the administration of the exogenous cortisone causes the dose-dependent change in the levels of the so-called oxidative stress markers, which usually appears in various tables of the mechanism of action of ozone and other medical gases. Thus, the inhibitory analysis clearly shows that the endocrine nature of the reaction of the rat bodies to ozone. We have shown that during the systemic course of ozone therapy procedures, pronounced unpredictable oscillatory dynamics of the cortisol occur, which ends at the cessation of the procedure. We interpret these fluctuations as a reflection of the development of the body's homeostatic response to ozone intoxication. Moreover, the cessation of the fluctuations in cortisol levels usually coincides with the patient's transition to a state of stable remission of diseases and adaptive regeneration. The role of endocrine system in the physiological activity of xenon is also shown for xenon and other inert gases. One of the most remarkable therapeutic effects of hydrogen is antiparkinsonism. Occurs due to the stimulation of growth of the secretion of the hormone ghrelin. It is interesting to note that the ghrelin release is blocked by the adrenergic blocker in a manner similar to metopronone's blockade of ozone activity. This slide presents a list of scientific articles that note the effect of medical gases on the HPA, HPT, and HPG, the axes of endocrine system. Pavlov's conditioned reflex homologous as the basis of the systemic therapeutic effects of medical gases. The main role in the body's defense reaction to intoxication with any poison is presented by the endocrine system. Therefore, we propose to use the term homologous, derived from the Greek. Hormo, activating or hormonotrophic action, and oligos means small amount. This term have proposed by Townsend J.F. and Lukey Teddy seems to be more successful than the term hormesis, since it focuses on the hormonal regulation of the body's defense reaction to the action of small doses of the toxin. The concept of homologosis is an answer on a question: why so long remission period takes place after the course of ozone therapy? This problem is solved in a natural way, proceeding the possibility of forming of a conditioned reflex homeostatic reaction to any factor disturbing the homeostasis, including a toxic factor such as medical gas. In other words, a course of medical gas therapy, which is mainly a course of regular intoxication of a patient with medical gases in subtoxic concentrations, is essentially a course of developing a conditioned protective homeostatic reflex. Hereby, the improved concept of Pavlov's conditioned reflex homologosis as a theoretical justification for the use of toxicants in medicine has three sources and components. First, the state that there is a factor that allows to hide the toxic properties of the substance. Second, the state that the factor affects the organism and has an effect opposite to the toxic one. Third, the discovery of unconditional reflex of homeostatic reflexes and the possibility to fix them in the form of conditioned homeostatic reflex. Conclusions. The medical gases, with the exception of rare gases, xenon and krypton, and natural metabolites bioregulators with strictly limited concentration range. The use of exogenous sources of the medical gases can be used to restore the natural efficiency, like hydrogen and nitrous oxide, or to activate the homeostatic intoxication with subtoxic doses. Activation of the homeostatic system occurs in the form of unconditioned homeostatic reflex. From the dichotomy, the health norm, the disease deviation from the norm, it is followed that the unconditioned homeostatic reflexes are healing. The essence of the therapy with medical gases is periodic subthreshold intoxication, which creates a long-term conditioned reflex or remission of the disease. The conditioned reflex reaction is realized through the activation of the neuroendocrine system of the body and as such a tool of integral medicine. How to characterize the molecular hydrogen and other medical gases in the light of the concept of conditioned reflex homologosis, and what are the practical conclusions regarding the combined use of medical gases therapy? The key to understanding the place of hydrogen in the family of medical gases is the graph reflecting the relationship between the toxicity and the duration of remission as a result of the course of treatment with various gases. Yes, it can be seen from the figure. According to the criteria accepted in the toxicology, medical gases are divided into acutely toxic, maximum permissible concentrations from 0.1 to 1, the solid red line, moderately toxic from 1.1 to 10, and low toxic with concentrations above 10. Acutely toxic medical gases include ozone. Moderately toxic, with some reservations, include nitrogen and hydrogen sulfide, carbon monoxide, xenon, and carbon dioxide are classified as low toxic, with the latter being the least toxic of all medical gases, which is hydrogen. Among the low toxic gases, the triad stands out: xenon, carbon dioxide, and hydrogen. The toxicity of the group of gases is 100 times less than that of the toxicity of the carbon monoxide, which is the border between the low toxic and moderately toxic gases. This group, in addition to toxic properties, undoubtedly has its own therapeutic potential. The anti-radical for hydrogen, uh, the bacterial, the anti-inflammatory, analgesic for carbon dioxide, anesthetic, antidepressant for xenon. Ozone, as the most toxicant gas, when used systemically, is a pure toxicant, the therapeutic effect of which is completely determined by the body's protective effects. It is logical to assume that the therapeutic effect of carbon monoxide, the hydrogen sulfide, and nitric oxide is a mixture of the body's own therapeutic effect of body's defense reaction, and the share of the latter increases in the series carbon monoxide, hydrogen sulfide, and nitrous oxide. Finally, we believe that the share of the body's own therapeutic effect decreases in the series hydrogen, then carbon dioxide, then xenon, then carbon monoxide, then hydrogen sulfide, then nitrous oxide, then ozone. While the share of the body's protective effect in therapeutic effect of medical gases increase in the series. First it's ozone, then it's nitrous oxide, then it's hydrogen sulfide, then it's carbon monoxide, then it's xenon, then it is carbon dioxide, then it is hydrogen. The approximate dependence of the time of the remission during the course of the treatment with medical gases is shown by the dotted line. As seen from the graph, there is directly proportional relationship between the toxicity and the period of remission. This corresponds to the position that the strength of the condition reflects is greater and the stronger the disturbance of the homeostasis by the toxicant. If for systemic ozone therapy, the period of remission is depending on the age from 3.5 months to 6 months, then for the hydrogen in the treatment of chronic diseases is only a few days. This means the patient taking hydrogen is doomed to take it almost daily. It seems promising to take mixed type of systemic therapy in the form of course of procedures. For example, ozone hydrogen droppers or ozone hydrogen autoimmunotherapy. At the same time, the therapeutic spectrum of conventional systemic ozone therapy can be supplemented with the effects characteristic of the hydrogen therapy. For example, the effects of that contribute to the treatment of neurodegenerative diseases. According to the condition reflex homologosis, the prolongation of the remission periods in the treatment of neurodegenerative diseases with hydrogen can be expected due to inclusion of hydrogen affects the homeostatic reflection to ozone. Similarly, one can expect an extension of the periodic remission of the during the therapy with another medical gases, carbon monoxide, due to the inclusion of the latter in the composition of ozonated saline solution or in the composition of the gas mixture of autohemotherapy measure. We are currently testing the possibility of using the special devices developed by us and shown on the slide. A distinctive feature of the device shown in the complete autonomy. The synthesis of ozone oxygen mixture and hydrogen is carried out from distilled water and the carbon monoxide from a built-in cartridge with a service life of 20 hours. At that moment, a technique for the joint use of medical gases, hydrogen and nitric oxide, has already been introduced into practice of cardiac surgery. The hydrogen ozone boson was used as a source of hydrogen, and a standard therapy apparatus was used as a source of the nitric oxide. Gaseous nitric oxide and the hydrogen were supplied to the gas delivery line to the CPB oxygenator by administering with the oxygen supplied to the extracorporeal circuit. The amount of nitrogen and the hydrogen generated by the apparatus was supplied and was 250 to 300 milliliter per minute and 120 milliliter per minute respectively. An experiment using the mixture of nitric oxide and hydrogen was carried out during the surgical treatment of the acquired heart valve defects at the Academy of B.A. Korolev Scientific Clinical Hospital. The data on the level of cardiomyocyte damage marker troponin 1 during the surgical treatment of the patients, almost 80 patients, are presented on the slide. As seen from the figure, the hydrogen doubles the cardioprotective effectiveness of nitric oxide. The presumed reason for this is the known anti-peroxynitrite effect of hydrogen. Although we do not exclude the activation of homeostatic response to the toxic effect of the hydrogen. A model of the boson H2O3NO apparatus is currently being tested to study the prospectus of ozone and nitric oxide mixture in the therapy. Finally, a few words about the method for accessing the effectiveness of medical gases therapy based on its effect on neuroendocrine system. We previously argued that for a crucial role for the endocrine system in the adaptive response to medical gases. This also corresponds to the classical theory of stress, of which the oxidative stress is a type. Yes, can be seen from the slide. The central link that determines the development of stress is the hypothalamic pituitary complex. The structural features of the complex makes it possible to evaluate the parameters of its functioning based on the heart rate parameters. As shown in the slide, the anterior and the posterior nuclei of the hypothalamus determine the influence of the sympathetic nervous and the parasympathetic autonomic nervous system, respectively. In addition to the anatomical location of the nuclei, determines their sensitivity in the functioning of the body's endocrine system. By recording several hundred cardio intervals sequentially, we obtain the so-called cardio intervalogram. The type of cardio intervalogram depends on the patient's age. Based on a large amount of data, we have solved the inverse problem, determining the patient's adaptation age based on the spectral analysis of the cardio intervalogram. The solution is embodied in the boson test hardware and software complex shown in the photo. The program is available on the internet at ozonprotocols.org. The slide also shows typical dynamics of a cardio intervalogram during a course of ozone therapy. The diagram shows that activation of the sympathetic and the parasympathetic nervous system formally corresponding to the patient's adaptive regeneration. Using the adaptation age parameter as an indicator of the activation of the homeostatic system, we have developed the strategy and tactics for optimal therapy using a oxygen-ozone mixture. Application of the approach described above provides 2 to 3 fold increase in the effectiveness of a ozone therapy course, taking into account the unity of the mechanism of the therapeutic activity in the family of medical gases. We hope that the above theoretical foundations of the condition reflects homologosis, and the practical conclusions and the method for assessing the effectiveness of the therapy will be useful in relation to other medical gases. Thank you. Thank you, everyone, for your attention. Thank you for the valuable time. Thank you.